Hi, my name is Deanne, and I'm going to be presenting a case study teaching strategy today for 5309. The reference group is open heart trained nurses who are critical care nurses. We're going to be using a high fidelity simulation, and this is the hands-on portion of our advanced open heart class. Welcome, students, and thank you, Meredith, my co-instructor, for helping me with this high fidelity simulation. Today we're going to have a case study. Your patient here is a 70-year-old female admitted to the CICU post-CABG on pump. It was an elective surgery, and the history is a post-PCI in 1995 and 2006. Has high cholesterol. Some pertinent physical exam findings are skin is cold, clammy, lungs have crackles, decreased to absent breath sounds, and heart is tachycardic. So students, we're going to go through this case study and we're going to try and figure out what's going on with this patient. Here is some hemodynamic profile, as you can see here on your monitor.
Well, the patient's heart rate's a little tachycardic. Oxygen saturation is good, but blood pressure is low. Just about 80/53. PAP 19/10. I don't know what the cardiac index and output. We'll have to run some numbers.
Cardiac output is 2 and index is 1 with a wedge of 8 and SPR 2200.
Well, we need to do something. Looks like, what do you think? Volume? Post-surgery? A little dry?
Is she on any drips?
Yes. Yes. She came back out on a nitro drip at 30 mics.
Oh, we need to turn that off.
We need to turn that off.
Okay, good.
Good.
Turn it off, Britta.
I'm turning off the nitro.
Okay.
And then maybe a little volume.
Okay, so
With
that
that
albumin's
low
in the
wedge.
room, so we'll give it a little. At least, what, 250, right?
Yeah, do we have a chest x-ray?
Chest x-ray and maybe some labs.
Yeah, we have a chest x-ray. As you can see, there's some, in the case scenario, there's new surgical changes with sternotomy wires, mediastinal clips, coronary markers. Drainage tubes are overlying the bilateral hemothoraces and has a large heart. Pericardial effusion is not excluded. Lung volumes are low, and atelectasis along the right base, and probably the left lung as well. And there's a small component of pleural effusion on the left as possible.
And labs?
And these are some recent labs here, you can see. Here's an additional, you guys can look at the flashcard here for your reference, keep that out. Do you notice anything out of the abnormal?
Not bad at all.
H&H is not bad.
Post-surgery.
Post-surgery, yeah.
Yeah.
Okay.
Looks like BUN and creatinine are in a really nice normal range. Potassium's okay. Blood sugar's a little elevated, but we'll be starting the intensive insulin therapy if needed.
Okay.
This is your urine output. We don't have a urine output.
Urine output? Urine output's between 250 and 300 an hour.
Okay, that sounds great. Heart rate is down a little since we gave the volume. We're in the 80s.
Yes, this is the most recent vital signs, as you can see here.
Okay.
What kind of changes have you noted?
Well, the blood pressure's a little bit better. Our index and output look better. Oh, actually, great.
SVR is down, so that's good. And the wedge is up with the volume that we gave, so that's good.
CVP and wedge. So,
And
at
heart rate
this
is
point, I'd still be watching, but
Yeah.
Yep. Well, we're cruising along here, and 30 minutes later, this is what your patient's vital signs now show.
It's 87 over 54 with a heart rate of 120.
What do you think's going on?
what's
Feeling-
real tacky.
Real tacky?
Pressures.
Okay, so let's take a look. Skin is cool, pale, clammy. Patient's kind of moaning, having a little pain.
We're
right?
still not on any drips, right?
No drips.
Do you want to start any drips at this point?
Would think we need some
Well, we
kind
need
of
something.
Inotrope?
or
What kind of
something.
inotrope would you
Either
suggest?
vitamine or epi or
Epi.
something, yeah.
Insert
Well,
something.
Given the heart rate, would you want to start epi?
Probably not.
Okay.
Vitamine might be better.
Vitamine might be a better
affect
choice?
it
Good.
Also.
Excellent.
Increase our cardiac index
Yeah.
levels. We need
And
to
it'll
edit.
bring the SVR down
You
a little
know,
bit.
interesting though, but our wedge and our CVP are almost equal. That leads me to think of something else here.
They're
Is-
way high.
Yeah.
And even looking at our SVRs and PDRs, I have a lot of concerns. So
I've
we should probably
I've
get-
listened to his heart sounds and they are very diminished, more so than
What other test would you might expect?
Did you get another x-ray?
or an echo.
an echo.
We need to
We've got
see
some
it.
labs here.
And
We've
the
got
labs.
a H&H, a repeat H&H.
So it's going
Okay,
down.
it's
in
going
2
down,
hours.
so we got
That's
something going on
pretty
there. Possibly.
Oh my goodness. Wow.
This is
That's
what our
right.
recent chest X-ray
I'd say
shows a
we're-
massive bottle shaped
Yeah.
heart, and absent pulmonary vascular congestion.
So
And then call the
we
doctor.
got a
Call the
white
doctor.
doctor.
12 lead?
We have a 12 lead.
And,
Wow.
okay.
We've got
Oh,
sinus tack
pulses
with
and
electrical
things.
ultrasounds.
Yes,
And
we
then the
do.
echo.
So
And also the doctor has ordered an echo,
Okay.
which showed early diastolic collapse of right ventricular free wall and collapse of the right atrium.
Okay,
we
so
need the sternal.
we need this surgeon.
Yeah.
We need a surgeon stat.
Yesterday.
Surgeon.
So,
OR.
so
Sternal
have them
unit.
call the surgeon.
Yeah.
We probably got to find out if OR is available, correct?
Mhm.
Or if we're going to have to do it up here to open
So
it.
what type of
We have the
clinical interventions would you expect at this point?
to relieve the blood around the heart. So we're
And-
going to have to go in and surgically do that.
Sounds like what cardiac tamponade.
Cardiac
is what
tamponade.
we're leading towards. so,
Exactly.
yeah.
Perfect. You guys diagnosed Samantha. She has all the signs and symptoms of a cardiac tamponade with the decreasing vital, increasing heart rate and decreasing blood pressure. What other clinical signs led you to thinking that you were tamponade?
Well, the pulsus paradoxus was definitely there. You could see it in the 12 lead.
His heart sounded worse the
Worse.
second time around than the first time.
And that's
Good physical assessment skills. Very
And the
good.
CVP and the PA pressures were equalizing.
That's right.
Blood pressures.
And what other type of physical assessments beside the distant heart tones did you notice?
Well, his urine output was at one point very high. His chest tube drainage started to come down a little bit.
She was kind of cold and clammy and restless. And
Restless and
not,
Short of breath and
and
moaning?
The moaning was.
It's the restlessness,
Yeah.
something's not right here.
Mhm.
As you know, this is a medical emergency.
Mhm.
And other ways you can, as you're waiting for the surgeon and getting the chest cart, is you want to make sure the patient has enough oxygen, get enough volume. You had suggested inotropic drugs to increase the SVR and cardiac output. Butamine is an excellent choice. And prepare for emergency drainage.
And
Excellent,
probably-
excellent, excellent.
Reintubation.
And reintubation. All right,
Okay.
well, do you guys have any other questions about cardiac tamponade?
No, not at this point. No.
Thank you.
We're
No.
waiting for the surgeon.
Excellent. We'll
on
wait for the
bated
surgeon.
breath.
Before the patient comes. Yes, please. Excellent, good job.
Team. Yes.
All right, I think that went well.
Okay. Well,